Hi everyone. The case study is about a male, 53 years old, married with 2 kids. He's right-handed, and his shoulder that was injured, it's the left one, and he has anterior shoulder instability. He works as IT and in computers, and his hobbies is calisthenics. His first dislocation was during a road traffic accident. He fell on his left shoulder. The result was a scapula fracture and anterior shoulder dislocation. He didn't do anything afterwards. And his second dislocation was when he was 18 years old, while he was swimming. And also he didn't follow either rehabilitation program or immobilization. From his 20s to 80s, he was less active, although sometimes he was experiencing subluxation feeling. Around his 50s, he started calisthenics. And his third dislocation occurred when he started calisthenics. He had performed many handstands and eventually slipped over a plank position, possibly due to fatigue and a sweaty floor. At this occasion, he immobilized the shoulder for a month and followed the rehabilitation program. After this third dislocation, most of his activities of daily living were unaffected. He enjoyed sleeping on his arm in full abduction like this, but after the third dislocation, he couldn't hold this position, and this was actually one of his main problems. Moreover, during calisthenics, he was afraid to practice some exercises, such as when the hand is above shoulder level, when he needs to pull the body up, or the shoulder is adaptic and has to lift weight. Fourth dislocation was on 10th of October in 2020. Then he was 52 years old, and happened when he was asleep, with his arm probably abducted. And after that, he came to the hospital. He did an MRI CT scan that revealed anterior labrum tear, Hill-Sachs lesion, and possible partial supraspinatus tear, and bony Burkhardt lesion. His range of motion on the injured was the active as passive. He had full range of motion, but the external rotation in neutral was 70 degrees, and in 90 degrees was also 70. And while his non-injured hand had external rotation in neutral 90, and in 90 abduction, he had 130 degrees. Which means his Brighton criteria was 4 from 9, because he has also recurvatum, hyperextended knees, and his pain levels at the first, there were 3 at the rest and sleep, and 4 while he was moving, while the rest days it was below that. When the shoulder would settle after the onset of the injury, his pain levels would go down, but there would always be some fear avoidance into strenuous movement or apprehension. His surgery was on 9th of November of 2020 with Dr. Antonagannakis and his team, which was a shoulder arthroscopy bone block procedure, modified Edenhibinet, with associated with subscapularis augmentation and capsulolabral reconstruction. Thank you.